The patient is a 45-year-old male with no contributory medical history, contraindicating any surgical procedure. The patient reported that the root canal therapy had been performed 5 years prior to his recent visit. Examination of the mandibular right molar revealed that a previous attempt at root canal therapy had resulted in a perforation in the furcation. The initial treatment plan is to complete the root canal therapy non-surgically, remove the amalgam in the furcation, and repair the defect with MTA. The mesiobuccal and the distal canals had been treated non-surgically. The mesiolingual canal was untreated. Probing of the buccal aspect of the furcation reveals a 12 mm pocket. The occlusal seal is removed with a number 6 round burr on a high-speed handpiece. The amalgam in the perforation can be seen and is removed. With additional illumination from a fiber optic light, the gutta percha can be seen at the mesial canal orifices. Hemorrhage is controlled with a sodium hypochlorite on a cotton pellet. MTA is delivered to the perforation site on the floor of the chamber with an amalgam carrier. It is tamped into place with a large gutta percha plugger. The entire floor of this chamber and the defect is sealed with MTA. Small increments are again placed on the floor and tamped into place with the use of a cotton pellet. This enables the MTA to flow into all of the chamber recesses. Excess MTA is removed from the occlusal surface. The MTA sets in about 4 hours and will be examined in a later visit. At another appointment, periapical and periodontal surgeries were performed. At 3 months, there is radiographic evidence of bone regeneration. The patient is totally free of signs and symptoms. Starting at the distal line angle of the canine and continuing around both premolars in the foci area, the healed surgical site was examined with a periodontal probe. There was a 3 mm pocket in the foci where there had previously been a 12 mm pocket prior to surgery. This pocketing examination included the buccal and lingual tissues. A radiograph taken 3 years later shows complete apical healing and a slight radiolucency in the furcation.